Okay, so we've seen the commercials, but what exactly is osteoporosis? Dr. Bodo Brauer joins us with the answers and some preventative measures. Thank you so much for joining us.
Thank you for having me.
Absolutely. So let's answer that question. What is osteoporosis?
Osteoporosis is thinning of the bone, making the bone brittle, and predisposes to fractures, to breaks of the bone.
Okay.
Which, especially in the elderly, can be quite devastating. Broken hips can be fixed with a high mortality rate. A lot of people have problems. Worse even is compression fractures in the spinal column.
Wow.
When the spinal bones just crumble like a dry cookie, and that usually means pain for the rest of the life.
All right. So what are some of the things that we can do to maybe prevent this from happening?
Well, the things that lead to osteoporosis are, first of all, low hormone levels, estrogen in women, which makes postmenopausal women more prone.
Wow, okay.
And also low testosterone levels in men.
Okay.
Not enough calcium, problems with the thyroid, an overfunction of the thyroid and the parathyroid glands, which draws calcium out of the bone and makes it more brittle.
Got it.
In addition to that, sedentary lifestyle, sitting around, not moving, and weight-bearing exercise, such as walking, is really the best thing to do.
Okay.
Calcium supplementation is needed. Long-term steroid use, prednisone, in people that have lupus or rheumatoid arthritis predisposes to this. And then the two enemies, too much alcohol and smoking.
Okay. So are there some things that we can do? Basically, are you saying take long walks and, you know?
Take long walks. First of all, identify the precipitating factors, such as hormone levels, not enough calcium supplementation. Those need to be remedied.
Okay.
And that kind of pushes it away. Then long walks, smoking cessation, not too much alcohol, and screening. Okay, the best way to screen is what's called the bone density scan, which scans the spinal column and the hip. And then, of course, identifying factors that may lead to osteoporosis in the past. And that is, check testosterone levels in males, check vitamin D levels. It is amazing. Vitamin D is a vitamin that is produced in the body from sunlight. And with our sun exposure, it is amazing how many people we have with low vitamin D levels.
Oh my goodness, I am one of those, I will say. I'll be honest with you. And for me to find that out, I realized that's why I drank so much milk when I was pregnant, because, you know, my body was lacking in that. So that's something that I started to do. And another question that I was going to ask you is, so does that basically mean that maybe more people need to take multivitamins, or kind of just find out what they're lacking and kind of...
They really need to find out what they're lacking. You know, hormone replacement in postmenopausal women is a questionable thing. Men with low testosterone levels, as long as they don't have prostate cancer, should be put on testosterone supplements. And then, of course, you know, your daily dose of calcium, your daily dose of vitamin D should be undertaken. And vitamin D levels, if they're low, need to be replaced with vitamin D3. Multivitamins do not have enough calcium, enough vitamin D in it to supplement what you really need.
All right. Well, sir, thank you so much for that information. Great information, as always, to know. I have one quick question. What age should I start looking at that? Or does
the earlier the better.
The earlier the better.
The earlier the better. You know, low testosterone levels in men can occur from age 30, 35 and on. You know, every year they lose more testosterone. And women, whether they have normal menopause or surgical menopause,
all right,
it's time to look immediately.
Thank you so much for that good information. Appreciate it. A complete look at your forecast is straight ahead with Dana.